Hi, everybody. It's Patricia Coughlin, and I'm here to remind you that a week from today, which is May 16th, Jonathan Entis and I will be offering a full day webinar on understanding and effectively working with conflicts around emotional closeness. Being able to identify tactical defenses, these are defenses that are used interpersonally, right, as opposed to formal defenses, which are largely intrapsychic. These interpersonal defenses of avoiding eye contact, crossing arms and legs, being vague in general, all kinds of things. These are tactics that patients use to keep an emotional distance from you. And if you don't learn how to identify these defenses, how to see that all these separate defenses are like bricks that end up creating a wall to meaningful contact and engagement that will undermine treatment if not skillfully addressed. This was one of Davinlou's really greatest contributions to the field, was helping us to, again, identify and then work with this system of resistances against closeness. If these are in operation, it doesn't matter how powerful your model might be or how much empirical support there is for it in the literature. If the patient isn't open, available, respond, it doesn't matter, right? You can offer them the best treatment in the world. It's going to bounce right off that wall of connection. So in this webinar, we are going to help you understand not only the specifics, like what are the defenses that are used in this way, how are they knit together to provide, to really create this resistance and this wall, but what is the underlying cause, right? There can be a variety of conflicts that would give rise to this. It could be that the person really has no interest in being there. It wasn't their idea. They're being sort of forced to come, right? Or it could be that they actually have a neurotic conflict, but they're so sort of anxious and embarrassed about revealing the specific contents, right, that they're avoiding and evading you. But could also be a manifestation of a character resistance, right? So one of the things that we're really going to be talking about here is, again, not just spotting the external signs, but then understanding the nature of the underlying conflict giving rise, right, to those defenses and resistances. And given that, how you are then going to systematically respond. That's going to be different based on both the underlying nature of the conflict giving rise to the resistance, but also the patient's internal ego structure. So you're going to interact with a neurotic patient differently than someone with a character disorder, and different again from someone who's quite fragile and disorganized. So we, in fact, are going to show you cases along the spectrum so you can see the need for case specificity and also flexibility in how you're going to address these resistances. Research is quite clear that about 20% of all outpatients are pretty open to practitioners. And so no matter who you are or what kind of therapy you practice, these relatively healthy folks are going to be able to engage, and they're going to respond to whatever it is you have to offer. But the other 80% are much more complex. They tend to have multiple symptoms and very often a character disorder that's really going to impact your interaction. So whether someone has a histrionic personality, kind of a paranoid personality, or is super detached and intellectualizing, as long as those defenses are in operation with you, they're going to create a resistance to the kind of emotional contact that's required to be effective. So again, we're going to elucidate these processes across the spectrum. So you're going to both see two different practitioners, right? Dr. Entis and myself. And then you're going to see how we deal with this with a wide spectrum of patients. So I think this is going to be really helpful to you. Again, no matter what your particular orientation, unless and until you get skillful at spotting and then dealing with these resistances, your effectiveness is going to be significantly undermined. So I hope you will join us next Monday, the 16th. I'm going to include the link to registration just below. So see you next week. Bye-bye.